So hi, my name is Mindy. I'm the East Oakland Air Quality Fellow. And for my summit project, I chose to talk about redlining and air quality and how they are connected. So my presentation is going to be an engaging presentation. So be ready to answer some questions. Next slide, please. So what is redlining? You guys can drop it in the chat. Okay, next slide. Redlining is a discriminatory practice dated back in the 1930s that denied services like mortgages, insurance loans, and home repairs based on race. Maps were used to outline certain areas deemed hazardous, and these areas were color-coded on the map red based on race. And these areas mainly consist of low-income people of color. Next slide, please. So here is a redline map of Oakland. And the red areas were labeled hazardous, and it was marked grade D because there was high populations of racial minorities, and it was least desirable for housing investments. And there were bad housing conditions and high rates of poverty. And the yellow areas were marked grade C because there was older housing, lower income residents, higher racial diversity. And the blue areas were marked grade B because these areas were considered favorable for housing investments because they were well-maintained housing and residents were mostly middle class. And the upper green areas was like labeled grade A because these areas were considered the most desirable for housing investment because there was stable housing and there was high populations of white residents. Next slide. So zoning is a blueprint of how land is used in cities and towns. It divides areas in different categories, like this space is used for residential use. This area is like for commercial use, and like this area is for industrial use. So redlining impacted zoning decisions because redline areas were zoned for being near industrial facilities and waste disposal sites. And zoning is important because it prioritizes public health and safety and land use decisions by preventing pollution sources from being near parks, schools, and residential areas. Next slide. So how do you think the practices of redlining has impacted air quality in communities, and what are some examples? Next slide. So, oh, I see a chat. So Michaela said redlining is a practice from the 1940s, and I can't believe the effects are still felt throughout communities to this day. That is true. So yeah, redlining had a significant impact on air quality because neighborhoods that were historically redlined are more likely to be located near factories or refineries and freeways, which can contribute to higher levels of pollution. And studies have shown that there are higher levels of PM 2.5, which are tiny fine particles of pollutants caused by coal power plants. And there are also higher levels of nitrogen dioxide, which are pollutants composed of nitrogen and oxygen caused by fossil fuels. And there are also less trees and access to green spaces that help combat the excessive pollution. Next slide. Some of the community impacts were redlining, limited access to healthcare facilities, grocery stores, public transportation, schools, and parks. And there's a higher percentage of Black and Latino Americans in redline areas facing greater exposure to smog and PM 2.5 compared to white people. And after redlining became illegal, many residents in the Bay Area feel like there hasn't been a change because of the increase of respiratory issues. Next slide, please. Some of the health impacts that are statistically shown are associations between redlining and pre-existing conditions for heightened risk of morbidity in COVID-19 patients, like asthma, diabetes, high cholesterol, kidney disease, obesity, and stroke. And the life expectancy is lower by 3.6 years in redline areas compared to other areas that weren't redlined. Next slide. So over the past few months, I've been monitoring the air quality in my neighborhood using a website called Purple Air that tracks the level of PM 2.5 in the air. And I live in East Oakland near the Laurel District. And I noticed in the months of November through December, the air quality index levels exceeded the 100 to 150 range, meaning that the air quality is unhealthy according to the air quality index scale. And when it exceeds 150, that means the air quality significantly affects people who have respiratory problems. And I also noticed that in the beginning of January through March, there were a lot of storms and heavy rains that helped decrease pollution levels. And the air quality index didn't exceed past 50 on days that rained. Next slide. I recently conducted a survey asking people how the air quality is in their neighborhood, and I got 15 responses from the fellows and my friends and family. So I asked how the air quality is in their neighborhood, and 33.3% of the people said it was fairly good. 13% of the people said they didn't know. 6% of the people said it was very good, and 26% of the people said it was good, and 20% of the people said it was poor. And it shows most of the people in my survey feel like the air quality in their neighborhood is pretty good. Next slide. I also asked if they or anyone in their family have like asthma or other respiratory illnesses, and 66.7% of the people said yes, 13.3% of the people said they didn't know, and 20% of the people said no. And it shows most of the people in my survey have asthma or know people that do have asthma. And air pollution, like people who have like asthma are like more vulnerable to like air pollution. Next slide. I also asked people if they like live near a factory, and 60% of the people said no. 20% of the people said yes, and 20% of the people said they didn't know. And I realized I heard like most of the people in my survey, like they live like near a freeway. More of them like don't wait. More of the people live near freeways, and um factories and freeways both like are like bad for like cause like bad health impacts to people who have asthma. Next slide. I also asked if they felt heard by the government agency, and 60% of the people said no. 40% of the people said they don't know. And it really shows that um, uh, most people don't like know like what the government is doing about addressing air pollution. Next slide, please. Um, so there is a correlation between trees and redlining. Older, larger trees have more canopy cover than smaller trees, which can impact air quality because bigger trees absorb more pollution. And redline neighborhoods had consistently lower tree diversity and larger trees, which explains why redlining is associated with poor air quality and health outcomes. Next slide. So here is a tree equity map of Oakland that shows the distribution of trees. The darker green areas shows neighborhoods with greater number of trees, while the lighter areas represent neighborhoods with fewer trees. And the lighter areas were areas that used to be historically redlined. And it shows like there is like barely any trees there. Next slide. So what are some policies we can implement to reduce air pollution in redline neighborhoods? Next slide. So one solution is the Oakland General Plan, which is a document that includes a visionary blueprint of the city of Oakland and will help the city develop equitable land use to prioritize the health and well-being of communities. And their visions are having like industrial sites being located farther away from residential areas and easy accessibility to transportation and green spaces. Next slide. And over the past 6 months, I've been involved with AB 617. I've been joining meetings, listening in, and taking notes on people's ideas. And they also have something called a SERP, which stands for Community Emissions Reduction Plan, which is a 5-year plan that would include solutions to address longstanding air quality issues in East Oakland. Next slide. So some of the strategies so far are increasing air monitoring, shutting down pollution sites and preventing them from being near schools and neighborhoods, ending racist practices like redlining, investing in transitioning industrial sites to residential land, and having polluters contribute to improvement funds like parks and green spaces and cleanups, and planting more trees and like building more green spaces. Next slide. So in my AB 617, in my work with AB 617, I learned a lot about the strategies we can do to improve air quality in East Oakland. And we can use these solutions to help solve air pollution issues caused by redlining. And it was also a good experience being involved in a government process to help address air pollution. But some difficulties I experienced in the AB 617 meeting was sometimes I felt confused because 80% of the time they would talk about the roles more than discussing issues and strategies. And during the meeting, someone mentioned the reason why air pollution is allowed is because of the history of redlining and how this history should be addressed in the AB 617 plan. And this gave me an idea to choose this topic for my presentation. And I feel that it's important to learn about the history of redlining and educate others and about how it excluded communities from having cleaner air based on where they lived. And in addressing these issues, we can develop effective solutions so everyone can have cleaner air to breathe. Next slide. So that is the end of my presentation. Thank you for listening.